Okay, now let's look at assessment number one. If you picked assessment number one, you picked that we want the head of the bed elevated. This is correct. We do want the head of the bed elevated. We want to elevate it about 45 to 60 degrees. We don't want to elevate it 90 degrees. When you elevate someone that high, you're going to put a lot of tension on the suture line. We want to prevent the neck from having hyperextension and flexion. Again, we're putting tension on the suture line there. No pillow, that is incorrect. The patient may have a pillow. The pillow is not going to hyperflex or hyperextend the neck, so we just put the pillow down behind the back area on the upper shoulders. Oxygen therapy, my question would be as a nurse, why would you pick oxygen therapy? Think of the reasons why we would put oxygen on a patient. For oxygen therapy, unless the patient was just extubated in the recovery room and not doing well, or they came to the floor and their O2 sats were low, we could put oxygen therapy on them, but only after we do some nursing interventions, such as having them deep breathe and cough, waking them up, making sure they're more awake and alert. Vital signs need to be taken, but vital signs are not one of the priorities here. They're not one of the top three that we would take with a patient who just came back post-op. Remember the fact that with vital signs, your heart rate is going to go up if you're bleeding. But with that point, the heart rate post-op surgical could be going up for a number of reasons. The patient could be anxious, the patient was just moved, or the patient could be in pain. Blood pressure, remember to see a change in blood pressure. You would almost have to have at least a 45% blood loss prior to seeing any decrease in your blood pressure. So assessment number one would not be your priority assessment.